I want to bring back Kelly O'Donnell and NBC News public health analyst Dr. Irwin Redlener now. Kelly O, I mean, there was some news made here. Just a top line, they're going to open 2 new FEMA-supported sites, one in Atlanta at Falcon Stadium, the other in Cleveland, Ohio, on the campus of Cleveland State University. But what we had basically been waiting and hoping for was some new guidance from the CDC for folks who have been fully vaccinated. There had been some thinking that we might have gotten it yesterday, maybe even earlier in the week. Any idea what the holdup is on this new guidance?
The specific on why it's being held up, I don't know. But to give people a sense of what we're talking about is now that there are millions who have been vaccinated, is there a new protocol for them in how they gather with others and how they go out into the world? Do they need masks and so forth? Those sorts of specifics, which undoubtedly will cause some questions and consternation. Because what we've heard from Dr. Fauci, for example, when he's been asked about this informally, not as CDC guidance, is that if people are in a family and you have more than one person in the family and they have been vaccinated, it was his expectation that they could be together maskless. Is that what the CDC will ultimately decide? And they talk about the issue of wanting to have more science and more data about even those who have been vaccinated. Can they still shed virus? Can they infect others, even if they have protection themselves? So at a time when we're seeing some states rolling back some of the mitigation steps, and at a time when there's a lot of fatigue in the country about getting through a whole year of doing this, could it confuse things if they provide new guidance that in some way muddies the water? But we don't know why it's taking longer. Typically with the CDC, when there is an expectation of a report or guidance coming out on a given day and it doesn't happen, it suggests there's ongoing conversation or perhaps new data. The White House has been asked about this, and they have said that they are waiting to receive it, that they are not kind of interfering with it or trying to shape what the guidance will be. They're leaving that up to the medical experts at the CDC. But it's something many people are interested to learn, especially as you have in lots of families where grandparents and great-grandparents may have been vaccinated now. What sorts of interaction, what sorts of restrictions need to go forward? Craig?
Yep, Kelly O, that's important points there. You know, Dr. Redlener, we just heard there, I don't want to make sure I get this right, nearly 55%, well over half of folks over the age of 65 have received at least one shot, more than any country, according to the task force there. We've got 18 FEMA-supported sites now. They can deliver up to 60,000 shots a day at just these sites. We've got lots of shots going into arms. According to Andy Slavitt, more than any country in the world, although I think if you look at it per capita, that probably changes. But Dr. Redlener, how important is it to get this guidance out with so many Americans walking around vaccinated now?
Hi, Craig. Yeah, well, it's really important. But, and, you know, we're just being inundated with really good news. This is such a contrast to a year ago, but we have a very competent team in the federal government, led by Fauci and many other talented people, including the CDC. And the news is good. We're getting a lot of people vaccinated, really beyond what even I expected. And I'm a pretty, characteristically pessimistic analyst of all these events, but I'm encouraged. The problem is we don't want to get ahead of ourselves either. There are issues looming in the wings here, Craig, like, for example, the whole issue that Dr. Fauci was talking about with respect to more and more variants that we might be worried about. So here we are now at this particular point in time, and your question is absolutely key. How do we, as citizens, as people, take the good news, not go too far, but when we press Fauci and he says, yeah, you can gather together with the other relatives who've been fully vaccinated, the CDC is not there yet. So we're at a moment where we should not be rushing it. This is one of the things that have been so disturbing about Texas, Mississippi, and now Alabama for reopening, as if we've solved the pandemic, which we have not. And this is really important for people to recognize. Yes, we're tired. I'm tired. We're all exhausted from this year of restrictions and fear about what was happening with the pandemic. For the moment, I think we need to wait for the CDC guidelines in order to actually change behaviors. As much as we all totally respect and adore Tony Fauci, We do want to see the CDC confirming whatever is correct to do right now and whatever is not correct yet. Eventually, and really, if Biden's promise of getting every adult male, every adult person vaccinated by the end of May is true, we could be looking at a much, much more relaxed summer and into fall. And I've been saying maybe even a normal kind of Thanksgiving this year. In the meantime, though, we still have to be patient and wait, Craig. It's tough, but that's what we have to do.
We're almost there. Almost there. It would seem lights at the end of the tunnel. We can see that light. Dr. Redlener, we also heard Dr. Fauci there talk about the plateau in the number of cases. He put up that graph. He said we plateaued, but there's a lot of activity in that plateau. He said it means we could see another spike. What should we be watching for in those numbers, Dr. Redlener?
So, Greg, this is also a very interesting question. So, at the peak of this, we were seeing, over 4,000 fatalities per day from COVID. The trend has been down, and now it's about 2,000. We should not be celebrating 2,000. We should recognize that we're making progress, and the number of cases per day is also diminishing. We're making progress, but that does not mean that we are out of the woods by any stretch of the imagination. We're going to have to be worrying about and keeping an eye on our ability to identify and track these variants. We have no idea whether or not we'll get a variant before we get herd immunity, whether we'll get a variant that could be very threatening in terms of much more contagious, much more lethal, and so on. So we're right now in a plateau, or call it a holding pattern, but we're waiting to see where this goes. But overly interpreting this data as signaling that we're ready to get back to normal is a big mistake. And I think the other point worth mentioning is that the CDC has been strongly advising, as has Fauci, but strongly advising that we do not relax our focus on these guidelines, which is we're all being sort of redundant here, but wearing masks, keeping distant, not gathering in large groups, and so on. And the thing that is important about this, too, is that we also need to be careful about being in small spaces that are not well ventilated, and so on. All of these things are in effect and should be in effect until we make a whole lot more progress.
Dr. Irwin Redlener, we'll leave it there. Kelly O'Donnell, a big thanks to both of you. Enjoy the weekend. Thank you again.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.